After our videos on the dental anatomy of primary maxillary anteriors, in this video we will be discussing about the dental anatomy of primary mandibular central incisor in detail. Watch the video till the end to understand it well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. According to the FDI tooth notation system, the right primary mandibular central incisor is numbered as 8-1 and the left primary mandibular central incisor is numbered as 7-1. Like other teeth, this tooth will also be discussed under 4 headings: the labial aspect, the lingual aspect, the proximal aspects and the incisal aspect. Starting with the labial aspect, first of all, the length of the crown cervico-incisally is 5 mm, the length of the root is 9 mm, the mesiodistal diameter of the crown is 4.2 mm, the mesiodistal diameter of the crown at the cervix is 3 mm. If we compare the dimensions of primary mandibular central incisor with that of the permanent mandibular central and lateral incisor, then the crown of a primary mandibular central incisor is wide in proportion to its length. Also, the heavy look of the root trunk of a primary mandibular central incisor makes this tooth resemble to that of a permanent maxillary lateral incisor. Overall, if we talk about the labial surface of the crown, then this surface is flat with no developmental grooves. The mesial and the distal sides of the crown are tapered evenly from the contact areas, with the measurement being less at the cervix. If we talk about the root is long and evenly tapers down till the apex. The root apex is pointed. Coming to the lingual aspect of primary mandibular central incisor, starting cervically and moving upward incisally, we can appreciate the cingulum. We can also appreciate the mesial and the distal marginal ridges. However, in between the ridges in the middle third and the incisal third of the crown, the surface may be flattened, almost merging with the mesial and the distal marginal ridges, or there may be a slight concavity present which is called as the lingual fossa. Overall, the lingual portion of the crown and the root converges so that it is more narrow towards the lingual side and not on the labial surface. Now, starting with the proximal aspects, particularly talking about the mesial aspect of primary mandibular central incisor, then the mesial aspect shows the typical outline of an incisor tooth, even though the measurements are little small. If we talk about the measurements particularly, the labiolingual diameter of the crown is 4 mm and the labiolingual diameter of the crown at the cervix is 3.5 mm. It is to note that the labiolingual measurement of a primary mandibular central incisor is just an mm short than that of the primary maxillary central incisor. Please observe the figure. If we talk about the incisal ridge as seen from the mesial aspect, then the incisal ridge is centered over the center of the root as well as between the crest of the curvature of the crown labially and lingually, as you can see in the figure. Also, the convexity of cervical contours labially and lingually at the cervical third is as pronounced as that seen in the primary incisors. You can observe the figure, and is more pronounced than that found on the permanent mandibular central incisor. Please observe the figure. Overall, if we talk about the proximal aspects collectively, the root on the mesial and the distal aspects is flat, has even taper, and the root apex is more blunt compared to the lingual or the labial aspects. However, if we compare the mesial and the distal aspects, then the curvature of cervical line is more on the mesial aspect than that of the distal aspect. Also, the developmental groove or concavity is absent in the root on the mesial aspect but is present on the root on the distal aspect. Lastly, talking about the incisal aspect, the labial surface from this view presents a flat surface that is slightly convex. As we move from the labial to the lingual side, a definitive taper is present towards the cingulum. Then the lingual surface presents a flattened surface which is slightly concave. The incisal ridge is straight and bisects the crown labiolingually. Also, the outline of the crown from the incisal aspect emphasizes that the crest of the contour labially and lingually are present in the cervical third. So this was all about the dental anatomy of primary mandibular central incisor. Hope the video was helpful for you. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.